My name is Mackenzie Carroll, and I'm going to be presenting on occupational therapy today and MSA. Just to start off, I'd like to disclose that I am not receiving any compensation from a pharmaceutical company or a similar company or organization. I will not be giving any medical advice, so I advise viewers to contact your medical service provider for any questions about diagnosis or treatment. So I'd like to start off by kind of giving a background about me in the field of occupational therapy. I went to school at Ball State University where I studied exercise science and Spanish. And then I went on to get my Doctor of Occupational Therapy at Belmont University, which is an additional 3 years of school. And then as far as my personal connection to MSA, my father-in-law recently passed away from MSA. And honestly, before hearing about his diagnosis, I'd never heard of MSA before, and I was surprised that school never kind of prepared me. So I did a lot of research on my own and decided I'd wanted to advocate for MSA. While therapists have experience with neurological diseases like Parkinson's, MSA has never really been brought to my attention until now. So it led me to want to promote MSA. So what is occupational therapy? Big picture, OT helps individuals participate in everyday activities while taking into consideration the individual symptoms, their needs, and most importantly, their desires. So some settings that you might see therapists work in, there's home health, where the therapist will come directly to your house, which is a great opportunity for them to kind of see what your day-to-day looks like. They can provide strategies for modifications in the house, and then just general therapy that you would see in like any other setting. The hospital, which is more seeing like quick sessions, they come in and assess maybe your loved one's in there for a UTI or things like that. So they'll come in there and decide, how are they doing now? Can they go home, or should they go to a rehab facility? Of course, in collaboration with whatever your needs are. And then rehab facilities, which is actually where I currently work, typically called skilled nursing facilities. So your loved one would transfer from maybe the hospital to this rehab for a couple of weeks to rebuild their strength. And it gives the therapist a chance to work directly with the caregivers to determine kind of what the next step is, whether it be to return home or to go to a facility for more care. Again, working with you on your specific needs. And then there's outpatient clinics. So this is where your loved one or yourself would go to the clinic and you would have therapy there. So this requires them to be kind of more mobile, getting in and out of the car. And they work on, again, the same things that the other settings would work on, just depending on what setting is going to meet your needs the best. OTs also work with pediatrics, hand therapy in schools and in the community, but for MSA, the ones I just covered are the most important. So to continue what occupational therapy is, we assist with activities of daily living, also known as ADLs. So as you can see at the bottom, these are things like eating, transferring, so moving from the bed to the toilet or bed to the wheelchair, continence, bathing, going to the bathroom, and getting dressed. These are the simple tasks that we do every day, but don't really think about it until we need help, how important they really are. So in order to increase independence with those skills, we help train on equipment, such as getting your socks on, their sock aids, things like that. And then just generally strengthening the upper extremity, the core, and working on balance. And with all of that, we provide education on fall prevention, home modifications, anything that can really help throughout the process of MSA. So occupational therapy is very important, but can't be done without the help of speech therapists and physical therapists. So just a brief overview of what speech therapy does and physical therapy. Speech will work on cognition, communication, and swallowing. So helping individuals with MSA communicate as long as possible, and also help with swallowing, which may mean modifying diets or just trying different techniques. And physical therapy helps with balance, leg, core strengthening, coordination, fall prevention, recommending mobility devices such as walkers and wheelchairs, and then activity tolerance. So these fields can be commonly mistaken because they seem very similar, especially when working together, which is true because we collaborate to assist patients towards their goals. Each discipline, OT, PT, and speech, are going to provide education and recommendations to help increase the person's quality of life. And the importance of these therapies is that we are trained to recognize signs and symptoms that are either concerning or just that we can communicate with the doctor to kind of make sure that the medicine they have you on is working, or maybe there's something that needs to be modified, and the therapists are able to communicate directly with your doctor. So in order to get services, OT, PT, and speech in any of the settings that I just kind of talked about, you're going to want to talk with your provider. They should be able to help get an order for whichever therapy or all three therapies. And they'll send the order, and then you can kind of set that up kind of based on your individual needs. So then we'll go into talking about setting goals for therapy. It's really important that I mention that every patient has their unique needs and wants that contribute to the goals of therapy. So this presentation is just a very broad kind of general overview of therapy, but everyone has their own needs. So the goals will plan for the progression of the disease from onset to the end of life. So helping you determine kind of what's going to work best for you now, and then what you'll be able to benefit from as the disease progresses, so that you spend your money and your time and energy towards something that's going to benefit you and the patient long term. And like I said, you can work directly, you can and should work with your therapist to set goals that are important to you. If you specifically want to just be able to get your socks on, or transfer to the toilet, or transfer to the shower, talk to your therapist and be very specific about kind of the areas you need help on. They can generalize goals, but just if you are very straightforward, kind of helps them lead and you get the most out of the therapy. But overall, the most common theme of goals is to increase the quality of life of the patient while promoting safety for both the patient and the caregiver, especially as the disease progresses. This is one of the most challenging things, is having the quality of life while maintaining the safety of both the patient and caregiver. As things progress, it's very difficult. So the symptoms that therapy helps to manage, orthostatic hypotension, which is the change in blood pressure when the individual changes positions, either from lying down to sitting up. The therapist can monitor the blood pressure directly when going through this to make sure that, just to see kind of how it's fluctuating and give you some strategies. Cognitive impairments and swallowing. The speech therapists, as well as other therapists, are able to recognize signs and symptoms of aspiration. Communication difficulties, like I said, speech and occupational therapy will both work together with this. Positioning, especially important in the later stages when an individual is bedbound, to prevent pressure injuries, and just rotating and then optimal positions for sleeping, which I'll go over here in a minute. Preventing falls, fatigue, and then managing incontinence and constipation. So next we'll go into fall prevention. PT and OT will both work on this, but preventing falls is a very important part of what we do. So I recommend the use of a gait belt. So when you're transferring from, say, the edge of the bed to a wheelchair or into a car, the belt goes around the waist. As you can see in the upper right-hand corner, the man is wearing a gait belt. You're able to grab onto the gait belt, and it's the center of the gravity. So you're able to kind of correct the posture if they do lose balance, and it's coming from their hips. Like I said, center of gravity. You're not grabbing on their arms. We're preventing other injuries, hopefully able to lower them to the ground easier. And again, this goes with orthostatic hypotension. So with the blood pressure fluctuating, we're able to monitor this and give you strategies for maybe sitting up on the edge of the bed for a couple of minutes before trying to get somewhere else, just taking time while your blood pressure kind of manages itself. Next, we'll talk about mobility devices. This will change throughout the progression. There are canes, rolling walkers, rollators, transport chairs, and manual wheelchairs. In the bottom right-hand corner is a rolling walker. The top right-hand corner is a rollator. A lot of patients like this. It's not always the safest, but it's got this built-in chair, which is nice for rest breaks. The lower left-hand corner is a transport chair, which is great for transporting individuals from, say, the car to an appointment, or from like when you're outside to get into the car for longer distances. And in the top left-hand corner is just a manual wheelchair. This is actually a really nice one. It reclines back, has leg rests, and it's a high back wheelchair. So this is great for the progression when it's harder to sit up straight, but there are more basic models of that. Next, to talk about positioning. Here I have a picture of a hospital bed, which is a very beneficial piece of equipment, especially as the disease progresses. But even in the earlier stages with sleep, having your head raised and being able to raise the feet of the bed. Insurance does typically cover it. It just depends. You have to have an order. But you see that the head's raised, the feet are raised, and the knees are also raised. So it helps with things like swelling, elevating your legs, and then also being able to alternate positions slowly. So raising the head of the bed before you go to sit up on the edge of the bed gives your blood pressure time to kind of level out. And I also have mentioned bed rails. So adding bed rails to the hospital bed is very important. It gives you something to pull onto when transferring in and out of bed. And it's helpful when you're rolling side to side if you are at the bed position. So to continue with positioning, if you don't have a hospital bed, there are wedges, as you can see in the top right-hand corner. These wedges are really great to elevate your feet if you don't have a hospital bed. Helps with swelling and blood pressure, along with TED hose and compression socks. So there's a picture in the bottom right-hand corner. Compression socks are great when you're up and mobile, whereas TED hose are typically used for those who are not ambulatory or more sedentary or bedbound. Check with your doctor for their specific recommendations, as there are sometimes contraindications for these TED hose. And then sleeping. So as you know, sleeping positioning is very important, and just getting sleep is kind of difficult for these patients. There's different positions. So the bottom left-hand corner, he is completely elevated. He doesn't look like he has a hospital bed, but this allows the airway, promotes an open airway to make it easier to breathe. And then also the side lying position, which is down in the middle. She has a pillow between her legs and then is resting her upper arm on a pillow, which again is just promoting the open airway, making it easier to breathe. Next, we'll talk about the adaptive equipment that I kind of touched base on earlier. In the top right-hand corner, there's a sock aid, which is a great tool to be able to get your socks on. Occupational therapists can train you on how to use this. It is difficult to get compression socks on using this, I'll preface that, but it's a good tool to just get your socks on. There's a button hook in the bottom right-hand corner, a reacher, some weighted utensils with a larger grip to make it easier to feed yourself. And then we'll move on to the bathroom environment. So in the top left-hand corner, I have a picture of an elevated toilet seat, and it has grab bars also. It can be difficult to transfer on and off the toilet with just a standard height toilet without grab bars. So this elevates the toilet, gives you grab bars to grab onto when transferring, especially in the later stages. And to the right of that is just a standard shower chair. This would be great if you have a walk-in shower already, so that you're not having to step over the bathtub. As you can see in the bottom, there's a picture of a tub transfer bench. This is one of my favorite pieces of equipment. It helps you, you transfer onto the side of the bench that's hanging outside of the bathtub. Then you're able to swing your legs up and over the bathtub into the shower. Makes it safer for both the caregiver and the patient. Then we'll move on to the grab bars in the bathroom. So in the top right-hand corner, there's pictures of grab bars. They have 4 of them, and they're all in really good position. Gives a lot of places for them to grab onto while getting in and out of the shower. Of course, I'd recommend adding a chair in there, but this allows them to be able to stand up during a shower safely and have something to hold on to. I do not recommend the suction grab bars that you can find at the stores. They do sell them and they seem very easy to place, and they are, but there's a risk of them falling out of the wall. I just haven't had good luck with them in the past. So if you're able to install them, that's definitely the best. And then in the bottom, all the way to the left, is a handheld shower head. This is easy when you're seated to be able to hold on to that and kind of do one part of your body at a time, turn the water off, and then turn it back on without having to reach or stand up to adjust the water. Then next to that is a long-handled sponge, which helps for decreased core strength and allows them to be more independent. So reaching for their feet or getting their back if the caregiver is not directly with them. And then to the right of that, I have some pictures of grab bars. These are placed next to the commode, both very appropriately placed. Just kind of depends on what your setup is like at home. So next, as we're talking about bathroom modifications, we'll just move on to general home modifications. So as we plan for the progression of the disease, a ramp is something to think about. If eventually they're in a wheelchair and you have steps to get into the house, you'll have to consider how you're going to get them in and out of the house. So installing a ramp as early as possible is very helpful if you plan on keeping them at home. Making sure that it is an ADA compliant ramp. So there's an appropriate slope that makes it safe for going up and down using a wheelchair. And then again, a width and with grab bars, things like that. Very specific recommendations for that you can find online. Removing throw rugs from the house. These just pose a fall risk. They get in the way. Declutter the house, remove extra items from the floor, increase lighting and use night lights, widen doorways. Again, this is to plan for the need of a wheelchair to get them in and out of the doors. I know widening doorways is not an easy modification to make, but if you know the width of your doors, it can help you select a wheelchair that's going to fit in and out of the doorways. And then stair lifts, a very expensive modification that you can make, and unfortunately doesn't always work for a long time. It requires core stability, the ability to transfer. So it's great for the beginning of MSA, but I will say it's not always the most practical modification to make. So with all of these, occupational therapists also are able to assist with energy conservation. So in addition to completing bathing, dressing, just your general ADLs, that's kind of takes a lot of energy already. So we talk about then how can we conserve our energy for other tasks, doing things that we want to do throughout the day. So organizing, planning ahead, and prioritizing your tasks. So maybe sitting down on the Sunday, looking at the whole week and determining, this is what I have to do this week. How can I spread it out throughout the week to make it easier on myself? So taking breaks, frequent short rest breaks, making sure that you are taking a break before you get tired. If you wait until you're exhausted, it's too late. So frequent rest breaks, distribute your tasks throughout the day. Maybe in the morning you get one small thing done, and in the afternoon you work on something else. Simplify your work, delegating responsibilities to others. It's really hard to ask for help, especially when you're stubborn, but asking for help from loved ones and just to help make your life easier. Avoid being in the heat for long periods of time and sitting instead of standing. So for as many tasks as possible, if you're able to sit, it does conserve energy versus standing for longer periods of time. And then we talked about caregivers, occupational therapists, and therapists in general also support caregivers as much as the patient. So I encourage you to join support groups. The MSA Facebook group is incredible. I actually joined that to learn a little bit more about the disease myself and just to kind of understand what would be beneficial in this presentation. So also finding local support groups for caregivers to understand what other people go through to help you feel like you're not alone. All this is said because changing roles is very hard when you're going from a spouse to a caregiver or from a child to a caregiver, it's difficult to make that transition and then also maintain your role as, say, a spouse or a child. So counseling, individual support, and hiring outside help if you need it. So, talking to your loved one early on and determining kind of what their goals are so that when you get to the point where you need help, that you're able to ask for it. This is a very challenging thing that I see outside of MSA and just any progressive disease where you need extra help. It's very hard to ask for extra help and to get outside help. So making a plan ahead of time is very important. And then I talk about hospice and determining goals, again, before the disease progresses, just to set boundaries for you and your loved one. So in conclusion, therapy can assist caregivers and patients with MSA through each stage of the disease, through planning, prevention, and modifying the environment. Therapists must create person-centered goals in collaboration with other disciplines, such as speech and physical therapy. And while therapy includes muscle strengthening, the goals look different with progressive neurological conditions such as MSA. And lastly, I'll end with my references, and I'd like to thank you for watching.